In 1796, a man named Edward Jenner performed what is now considered to be the first vaccine. Let's get into it. Okay, so this all started when Jenner was working at a hospital in London that had recently opened. This hospital was set up to take care of people with smallpox, which at the time was a horrible disease that killed lots of people. In fact, it was so widespread that most people got it at some point in their lives. The symptoms included fever, weakness, and a rash that turned into severe blisters, which then turned into pustules, which then fell out and left scars. So not something you wanted to mess around with. Jenner worked at the hospital alongside a man named Dr. Sutton, who was the head surgeon. And one day Dr. Sutton was performing an operation, and he noticed that one of the patients didn't seem to be feeling any pain. He asked the patient why, and they told him that they had recently had smallpox, which was interesting because normally, if you get an infection, you feel like crap for a while, but you usually get better. But this patient had gotten better without getting worse. Dr. Sutton realized that this might mean that this person had immunity to smallpox, meaning that they couldn't get it again. And if that was true, maybe we could use that to help other people. At the time, there was this idea floating around that you could get immunity to diseases by transferring fluid from the blisters of someone who was immune to the disease to someone who wasn't. It was thought that this would give the person immunity without them having to go through the whole getting the disease process. Now, Jenner had heard about this idea, but he didn't think it would actually work. That was until he met a milkmaid named Sarah Nelms. While taking care of patients with smallpox, Jenner noticed that the people who worked on his dairy farm seemed to be immune to it. He asked them if they had ever had smallpox before, and they said yes, but only after they had been exposed to cowpox, a disease that they got from milking cows. Cowpox was much less dangerous than smallpox. Most of the time, people only experienced symptoms like a low fever and small blisters that looked a lot like smallpox, but were much less severe. So Jenner thought maybe these two diseases were related and decided to do an experiment. On May 14, 1796, he took fluid from the blisters of a milkmaid who had just recovered from cowpox and injected it into a young boy. Then he waited to see what would happen. A few weeks later, he gave the boy more injections of the cowpox fluid just to be sure. And then even more time passed. On July, Jenner noticed that the boy was developing a fever and felt like he was getting the smallpox. But then something strange happened. Instead of getting better and then worse, like you normally do with smallpox, the boy got better without ever getting worse. Jenner realized that this meant the boy was immune to smallpox. Now, to prove that this worked, Jenner took fluid from the boy's blisters and injected it into another person. And just like the first person, they also became immune to smallpox. And that is how we got the first vaccine. So why is this such a big deal? Well, since Jenner's day, vaccines have prevented millions of people from dying from preventable diseases. Vaccines work by putting small bits of an infection into your body so that your body can make antibodies against it. And once your body has those antibodies, they can fight off the real disease. After Jenner published his findings, other scientists began to develop vaccines for other diseases. One of the most important ones was Louis Pasteur, who developed the first vaccine for rabies. Since then, we've created vaccines for tons of different diseases, and even for some types of cancer. But not everyone is excited about vaccines. Some people are worried that they might cause autism, even though there is no evidence to support that claim. Others are worried about the diseases that vaccines prevent, are still out there. But the truth is, thanks to vaccines, many of these diseases have become much less common and fewer people die from them each year. If you want to learn more about vaccines, check out the link below. And if you like this video, share it with a friend. I'll see you next time.